Now, what businesses want in a time of change, a time of uncertainty, and that's here forever and a day now, is to have resilience in their people. And the other thing is, to have a resilient employee, you need health. And I'm going to say right from now, I'm tired of people compartmentalizing physical and mental health. It's about health. We are struggling to get over the stigma of mental health. We're still struggling with obesity. We haven't tackled that really yet at the same time. But again, as the previous speaker said, if you're waiting for somebody to declare a problem and come to you, you've got a problem in itself, and you're actually creating more problems. Whereas if we actually started on the basis, let's make everybody resilient, because we're all going to face an uncertain world for the rest of our days, it may be a different way of doing it. So already I'm trying to put a different slant on the way that you think about things. And let's think about health, although I'm going to compartmentalize it a little bit as we go through this. So what are some of the common problems that we've all got to deal with? We're all living longer, but actually some of the data I was getting recently actually says with that length, not necessarily comes quality of life. When we're looking at ladies, you're going to have 19 years in ill health, men 16 years in ill health. That's a significant part of your life, which affects the quality of your life. The causes of morbidity, that's death and living with ill health, are changing a bit, but not that much. We've still got the main problems are back and neck pain, obesity, and the problems that go with obesity, and now depression. Depression, mental health isn't new. It was there 45 yeyears ago when I started. It's taken 45 years to get rid of the stigma. That's what's really happened as part of this. Smoking deaths are going down, that's great. Now, some of the things at the bottom four which really frighten me is we're now seeing type 2 diabetes in children and young adults. Now, that's your workforce of the future. I never saw in my early days type 2 diabetes in anybody under the age of 55 or 60. Now, this is coming about through obesity. Now, every child that I have seen who's obese with diabetes has one, if not two, obese parents. And we learn by behavior, we learn by attitudes, etc. So if you cannot get at your employees and change their behavior, the workforce coming up behind them is going to have even problems. And those children are going to die before their parents through the complications of obesity. That frightens me to death. We've looked at respiratory problems and air pollution. You're seeing more of that now with the environment. We're trying to tackle that, but that's a huge problem to deal with. And I'm also seeing a massive increase in the prescription of antidepressants. Everybody who comes to see me in my clinic has done two similar things. They've been to see the same specialist before they see me. Everyone, 100%, no matter where I practice. They've all been and seen Dr. Google, and Dr. Google is the answer to everybody's problems. And the vast majority are on antidepressants. Now, the antidepressants aren't going to solve the problem that caused it in the first place. And it sort of medicalizes a lot of issues as opposed to going right back to the cause of it. Another frightening thing is I'm starting to see people with dementia in their mid-50s now. And again, that used to be one of the elderly, etc. So there's some trends that are changing. And we've got to look at why those trends are changing and what we can do about it. I'm going to go past that in a minute very quickly, but effectively that's just looking at changes in disease patterns over the last 25 years. Diabetes has moved up, falls have gone down, but the top three are still there. Back and neck pain, skin disorders, depression. We've not changed that. But now we're going to come into what affects your health. What are your risk factors? Hereditary factors, gender and age. Now, what we always said about that was you could do nothing about your genetics. If you've got hereditary disease, particularly around the heart diseases, etc., the diabetic ones, etc., going out and shooting your parents was not going to affect your chances of not getting that ill health. That doesn't work. But you know what? I heard a lecture the other day on something called epigenetics. Now, I'd not heard of that term before. Some of you may have done that. But that's actually looking at your genetic makeup. It looks at your genome, which is your threads of genes that you've got there. And by changes in lifestyle, it is actually affecting your genetic makeup within your body. So you can actually adapt your genetic makeup and reduce your risk. And also the professor was telling me at the same time, he's from California, was saying if you've actually changed your genetic expression, that then can be passed on to your children. So this attitude that just because you had a genetic problem, you had a fixed problem, that's no longer the case. The other areas we need to look at is clearly the environment. We've talked about pollution, social status, communications, culture, lifestyle I'm going to talk about. But the biggest blocker to you, and it came out from the previous speakers, is about attitudes and behaviours. Until you actually get at people and change their attitudes and behaviours, yours, you will not make those lifestyle changes. Most people stop smoking when they get the heart attack or lung cancer. Most people stop doing whatever they're doing. They exercise more when they're obese and they have the heart attack. And it's not due to lifestyle per se, it's due to their attitudes, their thoughts, and those behaviours. So a lot of people start to put in a lot of initiatives, I call initiative-itis, without actually really thinking it through. What are they trying to change? Are you just trying to change somebody's eating habits or exercise habits or sleeping habits? Because they're short-term and they're not fixes. What you need to do is look at attitudes and behaviours. That's where we need to start. Probably seeing I'm not a traditional medic by any way. So I'm going to compartmentalise these two things now. We'll look at physical health and the problems that we see all the time now. The list of 5 there, they're the top of my list. And mental health, stress, depression, anxiety. I put stress at the top. But stress actually isn't an illness. It doesn't rank anywhere in the International Classification of Diseases at this moment in time, ICD-10. Stress is a perception. It's how you feel. I feel stressed, you feel stressed, I feel anxious, etc. The 2 illnesses are depression and anxiety, but I'm going to use the word stress because that's what everybody believes in. So if I then start to link that with lifestyle factors, the things that I really want people to change: physical activity, sleep, and I've put sleep there as number 2. And I think if you look at the science and the data now coming out around sleep, it's a bigger risk factor than smoking. It's nearly as big a risk factor as physical inactivity. But we take sleep for granted. And sleep can be managed and needs to be managed. Nutrition. On the bottom, I'm going to talk about mental resilience, work-life integration, not work-life balance. Work and life are important together. And I put social contacts in, because it's amazing how in the modern world of communications and social networking and everything that goes around that, people have stopped actually talking to one another and talking about themselves as human beings. Now, I want to actually look at each of those lifestyle factors and saying, if we address these lifestyle factors, how many of those problems can we address? The answer is, and it's meant to be complex, and I don't want you to try and trace those lines. The message is, if we address those lifestyle factors, the top 3 and the bottom 3, but mainly the top 3, you can affect all of those major illness factors. 70% of your risk is due to your lifestyle. 70% of your risk is down to your behaviours and your attitudes. Something like sleep. There's a paper that came out of Denmark, I think, a few months ago, which actually looked at quality of sleep, not necessarily quantity of sleep. But by getting the correct quality of sleep, you actually reduced your risk of getting Alzheimer's by 55%. Now, my end slide will try and pull all this together and actually say, well, how does that all link in? How can traditional medicine start to prescribe this? I'll come back to the traditional medical model. It will never go that way because of training, because of attitudes. This is not a sea change. It's not a super tanker change. It's a super tanker change to get this turned around. But you can do something through your businesses. And this is about reaching a tipping point by us all doing something individually and collectively. So where are these barriers to good health? The health service will never fix it. There's no incentive there. If we actually go to truly preventative medicine, then the vast majority of doctors and surgeons are out of a job. Particularly if you go to the States, they're not going to put themselves out of business. It's not going to work. The only way you can do it, I believe, is actually saying to doctors, you're only going to be paid when you aren't seeing your patients, i.e. they're fit and well, not paying you when you are being treated them, etc. So let's not rely on the health service, because that's not going to do it for us. You need to take ownership individually and as a business to make this happen. I go back to the beginning, resilient people, resilient businesses. But the biggest block is this negative attitudes and behaviours. This attitude that if I get sick, it's inevitable. I've got no control over it, and somebody will be there to fix me. Forget it. It's too late to do that. Change is difficult, yes. I admit, with being 46 years in medicine, I started life as a smoker, addicted to it. I used to smoke 60 cigarettes a day, and I'll admit to that. And to get through that, I know it's like to change my attitude and behaviour. I've not smoked for 40 years now. But I know what it's like, and it is difficult. Conflicting information advice. Dr. Google. People assume if it's on page 1 of Dr. Google, it's correct and it's right, and that's the law. It's not. And I think things you can do as a business is actually either provide yourself through hubs of sound scientific advice, which is consistent, simple, and easy to use, or through some of your providers as well at the same time. But if people have made that change, then they need support post-change. It doesn't happen. You need to keep that going. And then I think there's a lot of businesses that I speak to who believe in this, a lot of CEOs who believe in this, but then the attitude is, what do we do? And I think when I put at the bottom there is initiative-itis. And I think there are lots and lots of initiatives. Let's have healthy eating. Let's do a bit of exercise, whatever it is. Short-term initiatives don't work. The only way that this will work if it becomes cultural, embedded, with support from the top. So as we heard some earlier speakers say today, they believe it, they will take it in, and it becomes part of the culture, becomes part of the ethos. You've got to live it, you've got to breathe it, you've got to walk it. So again, I'm a simple person saying, so what are the simple things which will make a difference based on what I've talked about? Because at the end of the day, we've got to live and thrive in this environment of uncertainty and change. We've never seen more than we're seeing now. And, just take today. We don't know what's going to happen tomorrow in terms of a new leader in this country, let alone anything else. This is worldwide that we've got. Therefore, everybody that we see has got an underlying element of uncertainty and lack of trust. So do a number of things, and these need to be integrated. And moving across on the left, what I've got there is building a community. And it's actually getting people together. What I love first and foremost out of the previous presenters once was this attitude is collectively people can identify one another. There's a collective spirit there. Just by the fact of their clothing, they can identify. Doesn't matter where they've come from, they will identify. If you can identify people within your business and get them talking health, get them talking together, whether it's physical or mental, but I'm coming back to health, don't split them out. Nutrition, clearly, we know a lot about nutrition. And it's not about restricting people and making them miserable. You can live longer and miserably if you want, or you can live a pretty happy, nutritious life. But that's there to show a Mediterranean diet in effect. Exercise is brilliant. Now, exercise isn't joining the gym. And I will conflict with the previous presenters, but not necessarily getting a bike. It's actually getting a decent pair of shoes. It's actually walking. Now, I heard a presentation this morning earlier on from the CEO of Legal & General who said he walks to work. He uses public transport, etc. He gets walking in wherever he can go, and that's the way to do it, We would advocate for Virgin Pulse just getting 10,000 steps in a day. It's not easy, but if you have got the appropriate app, you've got the appropriate accelerometer on you, it can be achieved, and it becomes an attitude, it becomes a behaviour. So it's not joining gyms, it's walking. Simple as that. Mindfulness, I've put at the bottom there. I'm a great believer in mindfulness and your thoughts. Because just about every person that I've seen with a mental health problem, it has been started by a single thought. And that single thought became a story, and that became self-perpetuating. Then they didn't sleep, then they lost energy, didn't concentrate. And then they had a 10-minute consultation which says you're depressed, have a bottle of tablets. That doesn't work either. So mindfulness is wonderful as well. And I'm leaving the last one on the right there, which is sleep. Sleep's the big one. And I think if you do, one of the real things that you could do is look at education for sleep. And as a business, look at the impact that 24 electronic working has on people's life. Blue lights from backlit tablets. It's funny, tablets in my day used to come out of a bottle and you take them twice a day. Tablets are a different connotation now. When I look for my tablets at home, my grandchildren go and pick up the iPad. It's changed. But if you could just do those 5 things integrated culturally and get people to do it and change their attitudes and behaviour, go back to the beginning, 70% risk is reduced. That will make a huge difference and a huge impact. So let's change it a bit. So instead of that person coming in and saying to me, I want a prescription, whether that's for their blood pressure, weight loss, antidepressants, painkillers. Do you know, I heard something 18 months ago about a pharmaceutical company who was going to start and invest in creating a tablet for loneliness. That just shows how far we've gone, doesn't it? So let's not talk to your neighbour or your friend, let's give them the bottle. So how could we change that? And if I had a blank sheet of paper, if I could really go to it, I think I'd as a doctor, would work in a different way. So I would actually you look at your diet, and we go right back to Hippocrates, the father of medicine. He said, and if you go back to his dictates there, let food be thy medicine, let medicine be thy food. This is not new. So let's say to people, eat well 3 times a day. Let's take your exercise as often as you can. That's the dancing tablets at the top. Meditate once a day and take 8 hours sleep a night. Now, if as a medic I could prescribe those, I would have far more of an impact than I would by prescribing. I go back to my 11 years in general practice. I might, and it's a big might, have influenced 1,000 patients over those 11 years to adopt a lifestyle approach to managing their obesity, their hypertension, etc. The work that I do through Virgin Pulse, and we have millions of people a year who are changing their or reducing their risk to ill health just through simple activities such as walking, diet, sleep, mental resilience. I take great pride in that the years that I've worked for this business, I've probably influenced something like 20 million people to change their lifestyles, reduce the risk, as opposed to 1,000 in traditional medicine. And I'm really proud of that. So just to leave you with something, just to take away, I would like people to have a takeaway at the end. Something that you can do as a business if you've taken home the messages that I've got there. First of all, accept health, and use the word health, not mental or physical. Health is vital for their performance and your business performance. Then leadership's got to come from the C-suite, the CEO, CFO, head of HR. It's got to be embedded at that level in your business. If they don't get it, the rest will not work. It will become short-term initiatives. So you've got to have the wherewithal, the ability, the communication skills to influence the C-suite. And without that, you're really going to struggle. Develop this holistic approach to employee wellbeing culture, which becomes a culture program of the things that I've talked about. Bring it all together. Aim to achieve sustained behavioural change. That's what we do. We know through the data that I'm getting out of Virgin Pulse that we can look at people who've participated year on year, and we can see that they have actually cemented those behaviours into their lifestyles, and it is making a difference. We can see, and we've moved away from return on investment to value on investment. There's a whole lot of other metrics that you can use. You'll find it very hard to get a pound return for whatever your investment is, but looking at value on investment, you can turn things around there. Simple interventions. I'm coming back to being a simple Yorkshireman. Simple things work and work well. Be open and honest with conversations. And above all, recognise that we are all vulnerable, and it is about developing resilience. It's not about saying, let's make you mentally better, physically better. Let's make us all resilient for the future. If you do it for yourselves, if you do it for your employees, de facto, children learn by behaviours. They will work better, they will change their attitudes, we'll do other things as well. But this is just trying to give you a simple, 20 minutes is an awful short time to try and get some messages across. But I really do believe, and I practice it, that you can make a difference just by looking at that 70% risk. Don't wait for it to happen, manage it. And there's lots of examples around the world of companies who are doing it now. I'm going to stop there, but hopefully I may have changed your lives, if not your business lives.